Behind the Sheet portrays the suffering of enslaved women in the 1840s, all in the name of scientific exploration. Tragically, the events in the play form only one chapter in the larger story of powerless women being subjected to medical experimentation. Here to help us understand their stories is Dr. Deirdre Cooper Owens, a preeminent expert on medicine and the African American experience. Dr. Cooper Owens is the Charles and Linda Wilson Professor in the History of Medicine and Director of the Humanities in Medicine program at the University of Nebraska-Lincoln. Her first book, Medical Bondage, Race, Gender, and the Origins of American Gynecology, won the 2018 Darlene Clark Hine Book Award from the OAH as the best book written in African American women's and gender history. She is also the director of the program in African American history at the Library Company of Philadelphia, the country's oldest cultural institution. Currently, she is working on a second book project that examines mental illness during the era of United States slavery, and is also writing a popular biography of Harriet Tubman that examines her through the lens of disability. Dr. Deirdre Cooper Owens, welcome to LA Theater Works.
Thank you so much for having me.
I'd like to start with the events in the play Behind the Sheet. It seems unthinkable for us today to contemplate a slave-owning doctor performing surgeries on helpless victims. Yet you've written that the case of J. Marion Sims, the real-life doctor represented by the character George in the play, is complicated. Was he a monster or a product of his times?
Thank you for this question. I'm often asked about whether he was a savior or a villain or monstrous, and it is more complicated because as a historian of both slavery and medicine, I have to remind people that during the 19th century, James Marion Sims was literally born into a world where other human beings owned human beings, and this was an ancient and classical practice around the world. And so there was not anything unique about him owning slaves. Now, where I think the complication comes in is as a doctor in the 19th century who was trying to pioneer a field, the field of gynecology, what becomes really, I think, interesting and maddening for people in the 21st century is the issue that Sims didn't ask for consent of the patients who were enslaved. And I have to once again remind them that according to the law, chattel slaves were movable property and not legal human beings, although doctors produce surgery and surgical techniques on human beings. So there's a kind of, two-sidedness to the question. So was he a monster or was he a product of his time? He was a product of his time. He was not exceptional. He was, in fact, doing a thing that others like him did, particularly in the South. He was a part of a growing class of white men who wanted to become more elite in their personal lives, their wealth accumulation, their status, their professional lives. And so he did what so many other of his peers had done. And so it was a monstrous thing, right, to the slaves and to abolitionists for him to own slaves. But it wasn't necessarily a unique thing for a slave-owning physician to experiment on a population that was easily accessed.
You wrote a compelling essay about how your fertility treatments reminded you of the story of J. Marion Sims. What happened to you, and why did you think of him?
It's interesting. I think no historian wants to include themselves in their book because we write about the past. And yet, here's the complicated moment for me. I am the descendant of people who were enslaved. And I am the descendant of people who were enslaved in the state where James Marion Sims was born, South Carolina. And so for me, that legacy had always been present. I could never forget the kind of historical memory of those historical actors that I write about. Of course, I never imagined when this book was, just a dissertation that becomes a manuscript that then becomes a book, that I would undergo infertility treatments. But my husband and I found out as I was completing the manuscript that, in fact, there were some challenges around fertility. And so I was a great candidate for IVF. The other interesting thing is, Sims is considered one of the pioneers of artificial insemination. And so here he was kind of hovering around, in my own personal life. And so I remember going to the doctor, one of the best fertility specialists in New York City at that time. And I remember him telling me, there might be some slight discomfort for your cervical dilation, but just take 2 Motrin. And so I did. And what ensued was possibly the worst physical pain I had felt in my life. And the doctor was shocked that I was in pain. He had given me no anesthetic, nothing to relieve it. The nurse just stared at me in disbelief as if I was being histrionic. And then they left me in the room to wait and then walk across the street to the hospital for the HSG, which is another diagnostic test. And I'm leaving out some of the gory details, but I remember just being really shocked at what had happened. And African-American nurse kind of read my face, and she did the thing that I imagine Sims's enslaved patients did. She stroked my forehead and she touched me in a way that was soft and loving. And I remember she said, oh, well, the doctor said that you're a historian and you're writing this book. And so as we kind of talked, she said, well, girl, you got to include this in the book. And I said, well, I write about dead people. And she was like, honey, you better include this in the book. And I remember, kind of weighing that. And obviously I decided to. But in that moment, I used the words of the theorist Hortense Spillers, who teaches at Vanderbilt University, where she talked about Black women often being marked women symbolically. And so this cervical dilation was also done again a few weeks later, the doctor knowing how painful it was, and he still didn't give me an anesthetic. And so, of course, it reminded me of these early ideas that Black people, and in particular Black women, don't experience pain.
I just want to go back to the women in the play and the real women on which the play is based. Is there any historical record of them asking questions or protesting or making their feelings known?
No. So this is this is really the frustrating thing when you're a historian who writes about people who were illiterate and they didn't leave written records. So I literally had to write a book where 95% of the sources were written by slave-owning men who were anti-Black. They existed in a world where the idea of white supremacy was normal and healthy and flourishing. And it was what everybody kind of wanted to be in that society. And so to have to construct the lives of people who didn't leave a written record is difficult. But what I'm able to do, and I think by centering these enslaved women, I was able to read the sources differently. And so although some of the reigning ideas about Black people's distinctiveness from white people, or women being a subset of men who were inferior in many ways, right? Being led by their nerves or by their uteri instead of their brains. What I was able to do was think about those reigning beliefs about these people's inferiority and then read between the lines. So, for instance, the scientific belief was Black people didn't really experience pain, or if they did, it was so minimal. And yet you would read in some of the medical case narratives from James Marion Sims that, this surgery was particularly, he wouldn't use the word painful, but this surgery must have been uncomfortable because, XYZ person resisted. She lost sight of herself, right? She lost sense of herself and she resisted. And so one would think if this person can't experience pain, why would she need to be restrained? It seemed that you wouldn't need to do that. But also, how does a person lose sight or sense of herself and tries to move. So those were the passages, and often they were very short, not even complete sentences, sometimes phrases that I would zero in on to show the kind of racial cognitive dissonance that, in fact, the words might state that these are not full human beings capable of feeling the same kinds of sensations or pain that white people or men could feel, and yet the actual action was different. And so, no, there's not a kind of formal record of these women protesting because they were enslaved and they were also leased slaves. So they were not slaves that he owned. He leased them from other slave owners. And so after the experimental trial, he had to send them back, almost like you lease an apartment or a car. He sent them back to their original owners.
In your book, Medical Bondage, you also write about the 19th century gynecologists John Peter Mettauer and Nathan Bozeman. Was their work similar to that of Sims?
Oh, yeah. Mettauer was a graduate of the University of Pennsylvania. In fact, it was the rival school of Sims, even though he was a bit more advanced. Sims went to Thomas Jefferson Medical School, which is not very far from Penn. So Mettauer was a Southern-born man, Virginian, who went up north to get his education. He comes back. He becomes a really pioneering surgeon, not just in gynecology, but also, in various other ways, plastic surgery, all kinds of things. But he first writes about the vesicovaginal fistula surgery, and this is what it was called back then, and that's how Sims becomes pretty popular during this time. But Mettauer writes about it. He also does an experimental trial, but this time, unlike Sims, he is experimenting on a white woman who had just given birth and had a fistula or a tear during the birthing session, and an enslaved woman. And the white woman is cured, as he writes. The enslaved woman isn't. And Mettauer has this moment of transparency where you can tell he's frustrated because, as he says, he goes through 8 clinical trials and he can't seem to cure this enslaved woman. And he finally says it is because she cannot stop engaging in sexual intercourse. And so I'm thinking, how does someone whose body is owned by another person stop engaging in the thing that she cannot control? Right? But for me, it was a really great teachable moment that shows that although women in the 19th century, no matter, what racial group you occupied, were considered second-class citizens, but for an enslaved person who's not even considered a legal human being, right? She can't even during her moment of illness and healing, right? At least attempts at healing, she can't stop engaging in sex. Nathan Bozeman was Sims's one of the 2 surgical assistants that Sims had in the 1840s during his experimental trial. He later quit because Sims had just been failing, but later Sims sells his hospital in Mount Meigs, Alabama. Sims had eventually moved to Montgomery to finish up these surgeries. But he sells that Mount Meigs, Alabama hospital to Nathan Bozeman, who continues to work on enslaved people. And Nathan Bozeman, also like Sims, publishes medical articles. He gained some fame in the local area, a little nationally, but never was as well known as Sims. And he continues the same kind of experimental work on fistula patients as well.
I'm curious, when Mettauer operated on the white woman, did he use anesthesia?
No, because this was during the 1830s, maybe early 1840s. And so anesthesia was not popularly used then. And often when people used it, it would be dentists. Oftentimes people were experimenting on themselves with nitrous oxide. And Sims and Mettauer come from a time where a surgeon had to be really quick because the patient could bleed out. And so if a patient is put into what was then called twilight sleep, anesthesia wasn't a branch of medicine then. And so there was no exacting knowledge around how much could be used. And so it was actually better for the doctor, not necessarily the patient, but better for the doctor to have a patient who was conscious, because at least the doctor knows you're not going to bleed out and you can respond to the stimuli or the pain.
Mm. You've written that when considering maternal and infant health in the African American community, The legacy of slavery persists to this day. How does that history manifest itself in today's healthcare?
Right. This is, for me, this was always the hardest part as somebody who had the kind of safety of writing about people who couldn't talk back, right? And people were interested in my book, but they also wanted to know, how do we talk about what's going on in the present, with the past? How do we marry these things? And so what I had to realize was there is unfortunately still a legacy of medical racism that persists. And so this is a really stark fact. And I wish, I hope for the day that this fact changes. But the fact is, when you had folk in the 1600s, in the 1700s, in the 1800s, who were concerned about the promulgation and growth of slavery, natural increase becomes really important because according to the U.S. Constitution, the international slave trade was banned in 1807. So 1808 is the first year that the United States now has to contend with how do we get bodies for this really profitable institution that has buttressed our country's economy. And so slave owners take this into their own hands, and they began conversations with doctors to figure out ways to get Black women to naturally reproduce. And so although the United States originally received less Africans who were imported into slavery, all of a sudden it becomes one of the most populous slave nations because of natural increase. And so what does that mean? Slave owners and physicians are now concerned with increasing reproduction and enslaved women's maternal health, not because of, a kind of act of compassion or benevolence, but because they know that the condition of the enslaved mother is inherited through their children. And so this is why they didn't care about the paternity. In fact, there are U.S. presidents and vice presidents who had children with enslaved people. Most people know about Thomas Jefferson. So the paternity didn't matter, right? You could have a white father, a native father, an African father, right? That didn't matter. What mattered was an enslaved woman giving birth to an enslaved child. And so all of a sudden, freedom happens at the end of the Civil War in 1865. And the very thing that had been promoted and sometimes rewarded by individual slave owners, right? Black women having lots of children and those children and mothers living to be able to labor for those masters. All of a sudden, Black women's children and fecundity were seen as burdens, as financial burdens. And all of a sudden, they were seen as burdens to the state and a larger white society because they were written as a dependent class, although they were free. And so the legacy of this, unfortunately, is the kind of turning away from trying to ensure that Black women have babies that live past the age of 1 so that they can labor. There is a turn from that. And so Black women in the 20th and 21st centuries then have a larger representation of maternal morbidity and infant mortality.
What are the particulars about health care that would make it more dangerous for a Black woman to give birth than a white woman?
So often Black patients report that they are not believed. They are blamed for some of the risks and challenges that they face. So they'll say, we've been blamed by the doctors and nurses for not having prenatal care. They are blamed for their diet and being overweight, although the average American woman, regardless of race, tends to wear a size 14 or 16.
That leads me to another question. Can you give us a short course on how the histories of medicine and slavery in America are intertwined?
Sure. It begins really on the auction block because doctors are involved in the process of ascertaining whether an African, and then later we would say African American once the U.S. is formed as a country, whether these people are healthy. And so whether that is gum and teeth checks, whether it is the physical examination of the body. All of those things were really intertwined with U.S. slavery. So you would not go to an auction block, whether it was a rural space or an urban space, where there was not a physical examination that was done. I often have people, it's kind of what I call my hook. I often have people who are just in disbelief, especially my students, when I teach them this. I said, how many of you have heard of George Washington and his wooden teeth, right? His dentures. And of course, everybody raises their hand. It's the story we've all been told since we were kids in elementary school. And I said, what if I told you that most of the teeth in his dentures were extracted from enslaved people? And I said, so, they're like, what? How did this happen? I said, because there was a kind of easier access that doctors had, dentists had. So someone like George Washington, who was born really elite, owned hundreds and hundreds of slaves along with his wife, Martha, right? He had access to sugar. And so he can eat these things and they rotted out his teeth. Poor people didn't have that access. And so when it was time to replace his teeth, because he was also a high status individual and political leader and military hero, he then said, I need dentures. And so guess what the dentist does? He's able to go to a trade where you can extract healthy teeth from enslaved people, right, for someone who is elite. And so, that's much easier because you don't have to ask the enslaved person, can I pull your tooth? Yeah. Right? You go to the owner and say, okay, we need 6 teeth or we need 3 teeth and we'll pay you, XYZ for that. And so the owner agrees because, it is an economic labor system, slavery at least.
Finally, I want to return to Behind the Sheet and the story of Dr. J. Marion Sims. Given that he performed these painful surgeries on enslaved women and that his procedures provided a breakthrough in the treatment of fistulas, how should we remember him and the enslaved women today?
That's a really wonderful question, I think, and also a great meditation for us all to think about the value and the import of history. I think you remember them. Right? You just remember them. And for me, what is important is to not ever have James Marion Sims remembered without knowing that these enslaved women who were not only his experimental patients, but after his 2 white surgical assistants leave him, he gets to the successful treatment some years later, right? The successful repair of this fistula operation with the team of enslaved women who he essentially forced, right, to labor alongside him as they took care of each other and as they underwent these surgeries. So I often say tongue-in-cheek, James Marion Sims didn't get the surgical repair right until the enslaved women were his surgical assistants. And so that's how we remember him, right? Not that you invent or reinvent a past, but based on the most accurate information that we have from those records that he left, we can see that despite the prevailing ideas about slaves and Black people and Black women who were enslaved, they were able to help him reach that breakthrough. And so I think that's really important.
And on that note, Dr. Deirdre Cooper Owens, thanks so much for joining us today. This was so interesting.
Thank you so much for having me.